Shalom, Miss Christie. We are from Group 9. We'll explain about the muscular system. Me, Odelia, with my friend Deby, Melvin, Cleodora, and also Deby. This is our learning points or agenda. We'll explain about muscle definition, type of muscle, muscle structure, how muscle work, care and health, common muscle injuries. So, what is the muscular system? Muscular system is an organ system in the body whose function is to help the body move, maintain posture, and circulate blood throughout the body. We move to structure of muscle. In muscle, containing two types, which are muscle cells and muscle fibers. Muscle cells have three main types of muscle cells, namely skeletal muscle, smooth muscle, and also cardiac muscle. In muscle fibers, divided into two types, which are thick muscle fibers or actin and thin muscle fibers or myosin. Both function are proteins essential for cellular movement and contraction. Okay, first, skeletal muscle. Skeletal muscle have 7 structures, which are tendons, the base of the muscle that attaches to the bone. Second is epimysium, the layer that encloses a single muscle tissue. Third is muscle filaments, muscle fibers containing actin and myosin, like before I said. Fascicles. Fascicles is bundles of fibers within the muscle. Next is compartments. Compartments, bundles of fascicle. Perimysium, the middle layer of connective tissue surrounding bundles of muscle fibers called fascicles. And the last is endomysium, the innermost layer, a delicate shirt that wraps around each individual muscle fiber. Next is smooth muscle. In smooth muscle, just only have two structures. First is composed of filaments or muscle fibers, composed of actin and myosin. Second is the connective tissue that binds muscle fibers together, an autonomic nerve which automatically controls smooth muscle activity. And the last is cardiac muscle. Cardiac muscle, same like smooth muscle, just have two structures, epicardium and endocardium. Epicardium is the thin outer layer that surrounds the heart muscle, and endocardium is the layer that envelopes the heart muscle. Okay, further explanation will be explained in the types of muscle.
Skeletal muscle or striated muscles. Skeletal muscles comprise 30% to 40% of our total body mass. There are the muscles that connect to our bones and allow us to perform a wide range of movements and functions. Skeletal muscles are voluntary, meaning we control how and when they work. It's important to keep our skeletal muscles as strong and healthy as possible. There are a variety functions of skeletal muscles. First one, chewing and swallowing, which are the first part of digestive. The second one, expanding and contracting our chest cavity so we can inhale and exhale. Third, maintaining our body posture. Fourth, moving the bones in different parts of our body. Fifth, protecting our joints and holding them in place. Sixth, storing nutrition. Seventh, sustaining our body temperature. Our skeletal muscles are located between the bones or skeletal system throughout our body. They consist of flexible muscle fibers that range from the less than half inch to just over 3 inches in diameter. These fibers usually span and length of the muscles. The fibers contract or tighten, which allow the muscles to move bones so we can perform a lot of different movements. There are three parts of skeletal muscles. First, epimysium, second, paramysium, third, endomysium. Skeletal muscles fibers Skeletal muscles fiber are red and white. They look straightened or stripped, so they are often called straightened muscles. Smooth muscles. Smooth muscle is a type of muscle tissue that works automatically. This tissue is part of our body's most important functions, ranging from blood pressures and circulations to efficient how we digest food. Conditions that affect smooth muscles specifically are uncommon, but they can be severe when they happen. Smooth muscles is a type of muscles found in many places inside our body. It gets its name from how it looks, which is different from most other types of muscles. Smooth muscles is found in place throughout our body, like our airways, blood vessels, digestive system, eyes, lymph vessels, skin, and urinary and reproductive system. Smooth muscles has few main jobs. First, passage width control. Some of our smooth muscles manage the width of passages inside our body. Examples of this include our blood and lymph vessels and airways. Second, transporting substances. Smooth muscles can flex together to push what's inside a tube-like passage. This is how multiple sections of our digestive tract work. Third, gatekeeping. Most muscles stay relaxed and only Third, gatekeeping. Most muscles stay relaxed and only flex when needed. The smooth muscles in sphincters, like in our bladder or butthole, stay flexed and only relax when they need it. Cardiac muscles. Cardiac muscles is part of the human circulatory system, which consists of the heart and blood vessels. The systems use blood to supply our cells with what they need and remove what they don't need. The human heart pumps blood through a complex and extensive networks of arteries and veins. Human blood delivers oxygen and nutrition to our muscles, tissues, and organs. There are three basic functions of the circulatory system. First, to circulate blood through our body. Second, carrying oxygen and nutrition to organs, muscles, and tissues. And the third, removing waste products such as carbon dioxide and chemical byproducts from the organs. Day and night, even during sleep, the heart circulates blood throughout the body and the circuit. As blood flows through the body, it moves from the heart to the arteries, which carry blood to the organs and tissues. The human heart is located in the center of the chest. It is connected to blood vessels that carry blood throughout the body.
I will explain about muscle physiology. Whether it is skeletal, cardiac, or smooth, the muscle in the human body function to create force and movement, stabilizing body position and generating heat. First is producing movement. Producing movement is a result of contraction that rely on the integrated function of skeletal muscle, bones, and joints. Second one is stabilizing body posture. Skeletal muscle contraction stabilize body posture. And last is generating heat. Muscle ability to produce heat to maintain body temperature. I will explain about muscle properties. First is contractility. Contractility is ability to shorten forcibly when stimulated because of sliding filament theory. Second one is extensibility. Extensibility is ability of muscle tissue to stretch beyond its resting length without being damaged. The last one is elasticity. Elasticity is ability to return to resting length after being stretched or contract. How our muscle work? Our muscle can move because they contract and relax, which then pulls on the bone that is attached to the tendon and causes the joint to move. How our muscle contract? So when muscle contract, they shorten because the sarcomere also shorten, and the sarcomeres shorten because the actin and myosin filament slide past to each other, ultimately causing the entire muscle to shorten and generate force to move the skeleton, the tendon, and the joint. How our sarcomeres shorten? So when stimulated, the myosin head make a contact with actin. How? So the ATP that attach with the myosin head is hydrolyzed. This process creating ADP and phosphate and energy that can change the angle of myosin head. The myosin head now is ready to bind with actin. When our muscle contract, our brain release the calcium ion from sarcoplasmic reticulum. This process, which creates calcium ion bind with troponin, which exposes the active binding site on actin. Now, the myosin head can bind to actin and forming a cross bridges. As the sarcoma shortens, as the myosin head bend and pull actin along with it, this is release the ATP and phosphate and return the myosin head to a low energy state, which make the myosin head bind with another ATP molecule, causing the cross bridge to detach. And also, the calcium ion is pumped back into SR, or we call it sarcoplasmic reticulum, which this make our muscle relaxation.
Now we will go to the common muscle injuries. Here we have 4: sprain, strain, muscle cramp, and muscle dystrophy. Sprain is one you experience like something stretching or tearing your ligaments. Sprain means an injury to your muscle or tendons. Muscle dystrophy is a kind of disease that causes your muscle weakens over time. Now, muscle cramp. I hope everyone mostly experience muscle cramps at a time because it's like a sudden or unexpected stretching of one or more muscles. But with no worries, we can recover from this kind of muscle injuries. We can apply this RICE method. R, rest, I, apply your use ice and compressions and elevation to reduce your inflammation. And we can even prevent this common muscle injury by correct our posture techniques. And also, it's important to stretch or warm up muscle before you using them. The most important thing is drinking plenty of water. It's really necessary for your muscles.
So the next is care and health of muscles. Muscles are active structures of the body that support mobility, posture, metabolism, and functional balance. Caring for and maintaining muscle health is very important for all ages, both for performance and injury prevention. So these are several ways to care and maintain muscle health. So the first one is training intensity and muscle damage. Intense eccentric exercise can cause fatigue and structural damage to muscle, including the phenomenon of delayed onset muscle soreness or DOMS. Whoever prepare exercise can minimize this effect. You can do like plank or squat. The second is workout from home and muscle hypertrophy. During the pandemic, an independent exercise program or WFH carried out 3 times a week for 3 months was proven to increase chest, arm, and thigh circumference, a significant indicator of muscle hypertrophy. The third is ROM or range of motion exercise and muscle strength in stroke patients. Systematic review studies show that active and passive ROM exercise at least twice a day are effective in increasing muscle strength in post-stroke patients. Number 4 is strengthening exercise reduce muscle spasm. Providing strengthening exercise for 4 weeks to 2 sessions per week significantly reduces neck pain due to upper trapezius muscle spasm after the 3rd and 4th week. Number 5 is progressive muscle relaxation and decreased joint pain in the elderly. Progressive muscle relaxation techniques are effective in reducing joint pain in the elderly people in nursing homes. Last one is effect of progressive muscle relaxation on post-debridement pain. Progressive muscle relaxation intervention after surgical debridement have been shown to have a positive effect of reducing pain. Number 1 is deltoid. It is a triangular shaped muscle located on the shoulder. Its main function is to lift the arm away from the body, which we call abduction. It also assists in moving the arm forward and backward. This muscle is essential for shoulder stability. Next is the pectoralis major. This is the large chest muscle. It helps us bring the arm across the body, move it forward, and perform pushing movements. For example, when we do a push-up or bench press, the pectoralis is the main muscle at work. The next is biceps. This muscle is located at the front of the upper arm. Its main role is to bend the elbow and rotate the forearm, which is called supination. It is also one of the most well-known muscles because it bulges when contracted.
Next is external obliques. The external obliques are responsible for trunk rotation or twisting the body. Okay, the placement on our wrist. Yes. Next is iliopsoas. The hip flexors are responsible for hip flexion or moving the knee up to the chest. The placement in our crotch. Yes.
Quadriceps. Quad muscles or quadriceps are the front of our thigh. They help us straighten our knee so we can kick, run, and jump. But these muscles are prone to injuries like strains, contusions, and tendonitis. Our quads are voluntary muscles, meaning you control how they move and work. In Latin, the root quads means four or fourth, but recently they discovered a fifth muscle in this group. The 5 quad muscles are: first, rectus femoris. This muscle has 2 head originating from our hip bone and pelvis. It stretches down to our kneecap. It's the only quad muscles that spans our hip joints and knee joints. The second one, vastus intermedius. This muscle lies in the middle of our thigh beneath our rectus femoris. Like the other vastus muscles of our squats, its primary purpose is extending our knee. Third, tensor of the vastus intermedius. The most recently discovered squat muscles is a slanted muscle that sits between our vastus lateralis and vastus intermedius. Fourth, vastus lateralis. This muscle connects our thigh bone to our kneecap. It runs along the outside of our thigh. It's the largest of the 5 quad muscles. Fifth, vastus medialis. This muscle also connects our thigh bone to our kneecap. It runs along the inside of our thigh. It's the smallest of the quad muscles. Tibialis anterior. The tibialis anterior muscles, also known as the tibialis anches, is the largest of 4 muscles in the anterior compartment of the leg. Its thick muscle belly arises from its proximal attachment at the lateral tibia. The tibialis anterior tendon, or TAT, inserts distally the medial border of the foot. The muscle is primarily responsible for the dorsiflexions and inversions of the foot. The tibialis anterior is the stronger dorsiflexions of the foot. Dorsiflexions is critical to gait because of this movement clears the foot off the ground during the swing pace. Due to its insertions on the medial foot, the tibialis anterior also supports the medial longitudinal arch of the foot. The medial arch is higher than the lateral arch and is formed by following bones: calcaneus, talus, navicular, 3 cuneiforms, and the first 3 metatarsals.
This is the tricep. So the tricep are responsible to strengthening our elbow, for example like this. And then last one, this is called latissimus dorsi. So latissimus dorsi is responsible to adduction of our shoulder. For example, like this. Done.
I will continue to explain about the gluteus muscle. Gluteus maximus is located on your posterior. It's formed backs of your buttocks. It's the largest and strongest muscle. It's also maintaining our body in upright posture. It's important for walking, jumping, running, and providing pelvic stability. The next one is hamstring muscle. Hamstring is located on your posterior thigh. It's important for extend hip and flexion, walking, climbing stairs, and even running. Gastrocnemius muscle is the largest and two-headed muscles. It's forming back of curve. So you will know curve, it's on your back of lower leg. It's important for pointing toes down like plantar flexions and bending the knee flexions.